By the way, as Keir Starmer, the Labour leader, has done an interview today saying that the NHS is, as always, is broken, in crisis, and the future is in jeopardy under the Conservatives. But Dr. Laurence Gerlis joins us. He's a GP at Same Day Doctor. Good morning to you.
Good morning.
We're often told one of the reasons we're in crisis, people who smoke, got people who are fat, and there's some interesting stories around both those lifestyle illnesses, shall we say. In terms of tobacco, a group of health experts, leading medical charities and health charities and royal colleges have said that public spending on tobacco control measures isn't enough. It should be propped up by a polluter pays tax on tobacco firms to fund more of the anti-smoking initiatives. Isn't about 80% of a packet of cigarettes already taxed? In which case, are they not already paying?
Well, I don't see smoking as... I think it's a battle we've won. Fortunately, the best public health measure over the last 20 years was stopping smoking in pubs and restaurants. It's made an enormous difference to the patients I see. When I trained as a doctor, people would smoke 20, 40, 60 cigarettes a day. Then they went to, I smoke 10 when I'm in the pub, but not at other times. Now, most of the people I see, admittedly, they're not the poorer people, do not smoke at all. Now, if you're talking about diet and cigarettes, and we talk about health inequalities, one of the biggest drivers of inequalities between people of low and high income is these sort of lifestyle factors. And I don't think it's going to change. I don't think it's up to governments to change that. I think we've got to find ways of incentivising people themselves to take responsibility for their own bodies.
But also for people to have better lives, so they absolutely want to, take better care. I'm thinking I want to live a nice long time, so when I want to have, frankly, a Chinese takeaway, I have broccoli instead. I mean, that's, it's all very well. It's perfectly affordable to live have a healthy diet, and certainly affordable to not smoke. I don't know how anyone can afford to smoke these days, given the price of them, and even people getting them off the back of a lorry, they're still very expensive. So that is no doubt at all. Weight and particularly smoking are both very much sort of almost, there's a big class divide there, isn't there?
Yes, yes, and that's a real issue. But at the end of the day, it's up to the individual. I've been called a libertarian. Listen, we have one body. It's got to last us 80 or 90 years. You might change your car every 10 or 15 years. That body's got to last you a long time.
You can't change your body.
After it.
And this is the thing. I mean, I'm very anti-smoking. I don't like being around people smoking. I can't bear the smell. I was delighted when they banned it in pubs and restaurants, when having worked in pubs for many years and restaurants as well. So, I mean, that was good. However, I'm getting less nasty as I go older. As you see, they start coming for everything else. When they come for your chocolate and your wine, then you know things are getting better. Fascinating story, though, about tackling obesity or facing more tax rises. This is an Institute for Government saying every government has missed targets to cut obesity and failed to prioritise the issue and the cost on the NHS, damage to the economy of people who can't work. But also linked to that, front page story of the Times today, soup and shake diet can reverse diabetes. It's type 2 patients stay free of symptoms if they basically lose a load of weight on an 800 calorie a day diet for 3 months, largely on this soup and low protein shakes. And if they keep it off, then they tend to get rid of their diabetes. I mean, this is a new study. We already knew this.
Anything that helps you lose weight, any diet that helps you lose weight will control type 2 diabetes. This diet has nothing special about it other than you lose weight on it. And most people get bored of a diet after 2 weeks and they just revert to their normal eating pattern, which is often driven by habit rather than hunger. We all have eating habits. I'm the worst in that respect.
Absolutely.
And it's not driven by hunger. But look, yes, type 2 diabetes, as I tell diabetes is my special interest. I tell my patients, you can actually cure this condition by losing weight and eating a low carbohydrate diet, a balanced diet that's healthy.
Yeah, I mean, and there are lots of simple things like eating earlier in the evening when you can, and getting more sleep. I mean, all the things that don't go very well, by the way, with an early morning TV show. But this is the thing. A lot of this is very obvious. I'm not a fan of these sort of, these quirky diets. I mean, 800 calorie diet, the fast 800. I've done that a few times. Whenever I'm like, right, got to lose that holiday weight. Works a treat, and it's something the NHS recommends now. And it's really easily achievable, and you get results very quickly. But I do think it fundamentally it should be about adjusting your normal diet. You know, taking out a lot of the carbs, focusing on lots of vegetables, lean meat and fish. And when you do that, but you will the weight falls off you, but also it needs to be a lifestyle. You have to just change the way you eat for good. And you can't live on shakes and soup for the rest of your life, because that will make you miserable and you'll just go off it. And let's face it, you'll hit the kebab shop rather quicker. But there's so much. There's just so much around these days, trying to control what we can see on TV, what's at the end of the supermarket aisles. I mean, I can't find anything in my local supermarket anymore. Even the Easter eggs, they can't be near the front of the shop where people might actually pass them, but be useful ahead of Easter, because we'll all get fat. And they're trying to control our weight and what we put in our mouths. That should be up to us, shouldn't it?
Look, I think one thing we've learned from the pandemic is we're not going to be told what to do ever again. And I think it's about time people stop telling people how to live their lives. Give advice, make it available for people if they want it. But then please don't dictate to us anymore. We've had enough of that for the last 3 years, I'm afraid.
Here to that, Dr. Laurence Gerlis, GP at Same Day Doctor.